Good morning. Welcome to the Modern Day Tooth Fairy. I just finished a video, and before I get into it, I am Sandra Senzan. I have a practice at 580 Park Avenue, 64th and Park, and I'm going to do a bit of a longer video because they do cut me in my social media videos. So today I'm going to discuss microbiome, or the protection of gums and teeth that naturally are supposed to be protected by a microbiome. That's a film that comes from the saliva, and I guess it's God's gift to protect ourselves. They claim when you brush your teeth that you disturb it. So this dentist, actually, his mother was losing all her teeth, which is the shoemaker, the old story. The shoemaker's children have no shoes. Well, a lot of dentists, children and parents don't like going to the dentist. It could be a familiar thing, or it could be a psychological thing. I don't know what kind of thing it is. But most important, I don't know if staying away from brushing and cleansing is the right answer. Oh, look who's here, Pipey. And Pipey lost all his teeth, a lot of teeth. She was a rescue cat. And say hello, Pipey. She was a rescue cat. She delivered kittens and her uterus. And this is a rag doll. Say hi, Pipey. This is my little Piper Lily. I call her Pipalicious. I do these things. Now, Pipalicious doesn't love to have her teeth brushed, but I have a toothstick that really helps. And believe me, when I get inflammation in my mouth, let's say an area starts bothering me. I had a lot of work done. Let's say an area here starts irritating, getting red. And I sit in front of my TV screen, I will take a brush and shimmy it side to side, outside, inside, till I complete my whole mouth. Very, very important to do that. And the reason for that is that you want circulation. Blood, the natural ability of occlusion, biting, will create circulation to a degree. I have a patient who has an open bite. Now, he has a hard time occluding. A lot of it was done by a bad dentist who didn't really clean his teeth and caused a lot of issues. And Pipey is joining us today with those big blue eyes. Do you want to look at your... Oh, she ran away. I love this cat. Her name is Piper Lily, and she's Pipey, who sleeps in the bathroom. She's a character. So I'm going to try to make a little bit of a longer video, almost like a one-on-one podcast. I'm going to help you understand. And by the way, look what I wear. This is the Tooth Fairy, my little Tooth Fairy, my mother's wedding band into a Tooth Fairy. So now I'm going to explain to you what this video that I watched, that I just completed. The microbiome of the mouth is supposed to protect you from gum disease and tooth decay, not sugar. You can eat all the sugar you want, which I doubt, because if you put sugar on your skin and just take direct sugar cubes and put it on your gums, you're going to get inflammation. You take excessive sugar into your stomach, you're going to get more acidity. And that happens all through the body. So that's something that you don't want. I see my beautiful, look at this tree. You see my tree? That is a money tree. God, look at that tree. You can see it. It's growing all the way up into the sky. I got it. It was a tiny little tree, like my fish in the back. I have koi. They were this big. They were 3 inches. They are now 1 foot to 2 feet long, and they're worth a fortune. They're worth over $10,000 a piece. It's a good way to build money market better than the bank. Koi fish can be a better investment than the bank. Well, anyway, to get back to the microbiome, I listened and I listened, and it was very interesting because he said in certain islands that they chomp into frozen meat that produces good bacteria. I don't know if they were able to dissect or figure that out, but I wouldn't want to go and bite into frozen meat because I'd break all my teeth that I just spent a fortune on. I had a car accident in 1989, and so because of that, I had to redo a lot of work. It happens over time. There's reuse in the body. Like a good friend of mine has a hip operation. Patients have hip operations. They have knee operations. I believe in the way to heal is to go in with the pain. Don't let it get to you and try to work it out. Circulation all through the body. Walking. Try to not see it separate from your mind and body. And say to yourself, be positive. I am going to fix it. I have fallen on my knees over and over and shocked that I didn't break my knees. I've had car accidents where I banged my knee, and I'm bringing a little bit of self-healing to your attention. And what would I do? Well, of course, I had examinations, and they went and they put pressure right here. You know, this is the meniscus. And they said, oh, you have a torn meniscus. I said, no, I don't. I'm walking fine. So what do? I do Pilates. What does Pilates do? Pilates is isometric, almost a bit of isometric exercise. So you push and pull and you stretch. Your stretch means that you're creating a blood flow, a good circulation all through the body. It makes you not only feel invigorated, it makes me exhausted. I tell her, let me do my own thing. But it really energizes the whole circulatory system. And that's why I go 2, 3, 4 times a week. It adds What's circulation? Blood flow. Our body, if you have cloggage in pipes, what happens? It gets clogged and stuffed. Bacteria will get consumed in one spot. Happens all over the body. You don't want clots to form. You don't want bacteria to form. The mouth as well. It needs circulation. The best way to create circulation is with a brush. But you've got to know what you're doing. You've got to shimmy the brush, side to side, outside, inside. You could use a dry brush and work each section. Watch TV. It'll prevent you from eating junk food. It's a good diet. Outside, inside, outside, inside, outside, inside. And work that until you complete your mouth. Now I'm going to do some question and answers because I'm going to order that product, by the way, and in a future show I will get on and tell you if I believe in it or not, and maybe create my own lozenge with camellia oil, because it's not just the bacteria. You got to create a skincare solution to the tissue like you would your skin. Okay, I'm going to be the person talking to me. Can you believe it? That's a good way of being a ventriloquist. Okay, question. I have had bad breath all my life. Why? I'm talking about me. I'm talking about you, whoever you are calling me. Okay, what is bad breath? Bad breath can come from your stomach. It could be acidic. It could be the acid from your stomach coming through your mouth. Doesn't always mean it's from your gums and teeth. So cup your mouth like that, smell it, and you know what the pandemic did? It gave us masks. Breathe into your mask, smell the mask, and see if it has an odor. If it does, it could be coming from your mouth more than your stomach. Stomach acid comes up A lot of people over a certain age, including me, can get gastritis, especially from stress, which I get periodic. So you got to know where it's coming from in order to eliminate it. Most important, eating greens will reduce the acidity of the mouth. It gets rid of balancing the pH is so important. When you balance the pH of the whole body, it's important. So relaxing the mouth. Here's a TMJ right here. People tell me, oh, I have a TMJ problem. I just got a call from a patient. She's smart enough and spiritual enough to know how to break it. This is like the similar joint to your knee. It's a TMJ joint. It's a socket. And that can break, actually. It broke when I had a car accident. So what do you have to do? You can exercise that TMJ. You push up while your mind is pushing against the hand, like that. And the ligaments here will tighten. Keep doing that. Push down, I'm pushing up. Isometric exercise. Pilates of the mouth. Push in while I'm pushing out. Same thing on this side. Push in while I'm pushing out. You need to strengthen the TMJ. Now, if you have an irregular bite, is your TMJ going to heal? No. That's why I went to a prosthodontist for a bite. A great bite, great teeth. I'm finally smiling like crazy. I'm not embarrassed. So a prosthodontist is very important. They have more education in bite registration. It's very important to a periodontist, a prosthodontist, because they should be connected. Because if you have an improper bite, you can create periodontal conditions. Why? Because the bite's creating trauma. And what does trauma do? It breaks down bone. Yes. It can also, there are scientific research that it can build bone, but most of the time it breaks down the bone. So you have to be careful about what you're doing. My bite feels so great. I forget because it was off for a while. So I eat corn on the cob, which I love. And also another thing I do bad is by chewing chicken bones. I got that habit from my father, eating bones like dogs. Crazy. That could do a good job on breaking your teeth. So forget about the microbiome. You go chew certain foods and you will break your teeth. And that's why a lot of people have implants. You could break implants easily too. They're not permanent. Oh, I just found something out recently. The doctor I work with does beautiful implants. He did beautiful, even ceramic implants. So what happens if your bite is off, it's rare that you'll break the implant, but you could break the bone. So you have to have proper bite. Very, very important. If you don't, you ruin your whole dentition. So that's why a prosthetic dentist who is in their head, there's a lot of people today are not in their head. They're thinking ahead of time, or they're worrying, and they're not in the moment. And it causes disease. Not only in the teeth, it causes disease all over the body. It's just awful what goes on out there. So today we discussed a little about the TMJ, the bite, microbiome, which I do believe, but I don't believe that that's the cure-all. I don't think one thing is. I think circulation, and that's why I go for Pilates. I'm not 20, I'm not 30, I'm not 40, I'm not 50, I'm not 60. I am up there like a thermometer, but I keep vitality. I have passion. I was on Oprah, and Oprah said that I look good, because that was when I was 60, because of my passion. She wouldn't let me tell you that it was passion for my work and passion for everything I do. She talked about horseback riding, which was not my main passion. But that's the way showbiz is. One day, wait until my book comes out, I'll tell truth. And Dr. Oz, we talked about skincare. I was getting closer to what I wanted to talk about, but they wanted me to wash off all his makeup, and I said, no, I'm not doing that. So I dabbed it a little, and he hugged me, and he said, you don't look near your age. Now, every decade, I have a show promoting me on how I look. Now, when I hit 100, and I have this vitality, I'm blessed. Thank you, God. So now let's discuss the Invisalign. What is an Invisalign doing? People want perfect noses, perfect teeth, beautiful eyes, perfect straight teeth. All right? Perfect straight teeth at an older age can be detrimental. You use that Invisalign and you're tipping those teeth. You're not actually moving the teeth, you're tipping them. And if the bone isn't strong, you can cause a lot of damage. So what I tell people to do is to use my oil inside the Invisalign to moisturize the gum tissue. Please remember, it's tissue. It's not just bacteria. And the tissue needs circulation. I'll repeat over and over again. The tissue needs circulation, like our skin. Very similar. It's thin. If you abuse it, it will show itself, which you can't help half the time with expressions, and that's what Botox takes away. All your expressions, it paralyzes your muscles. Luckily, I have a very good bone structure here where I don't really have much wrinkles. My neck's, I'm going to cover it. I'm like a swan. I have a long neck like Audrey Hepburn. And that tends to fall down, and I don't want plastic surgery. I'm trying to prevent it. So even though I'm on TV and social media, I still want to look as vital as I can at any age. So let's discuss, okay, so we discussed TMJ, we discussed bite, we discussed circulation. Let's discuss whitening. I cannot believe that the microbiome was going to whiten your teeth. Stain happens because of coffee, because of tea, grape, chocolate. It just etches. It etches into the enamel. Enamel is porous, and it will creep in. So know how to neutralize the pH will help. Actually, my products do neutralize the pH. Peppermint is fabulous. Lavender is fabulous. I don't need to add preservatives. And I'm not just broadcasting my product. I really feel blessed that I was given this product by the higher self. It started years ago when a patient came in. My book got published for reversing gum disease naturally. And a patient came in and she said, oh, look at this little lavender. I use it on my skin. I use it to go to sleep. So I'm massaging it and just testing it into the tissue. And she actually gave me the first little camellia oil bottle with the lavender. I said, oh my God, what did I find? It whitened teeth and it tightened the gums. So please, if you need my products, call me after this video, which is, what is it now? It's 18 minutes. I want to do a half hour. I will send, you can look me up at my website, Perio, Perio-solutions.com. All right, let me be another customer or a patient. Let's say I'm coming to me, okay? Oh, Sandra, I don't know. I have shingles. I had shingles on this side, and there seems to be whiteness going on here. White. Well, let me tell you something. The nerves do get affected by shingles. And candida happens in the mouth as well. Now, what happens? I work the mouth where I create the circulation with instrumentation. I get in there and I create a circular movement with therapeutics to create circulation. And you could ask some of my patients, I've reduced all the pain that could happen from shingles. And not only shingles, But this great pandemic we've had, it can go into the nerves, into the nerve of your teeth, and cause damage. So if you need me, call me at 212-684-1844. I hate to be so whatever you call it. I don't even know what I'm talking. Anyway, but please, this is all truth. I love to talk truth about the tooth. Shingles can affect your mouth. It can affect your tongue. You can get L-lysine, by the way, is fabulous for shingles. So shingles can affect your tongue, your mouth, and most important, you want to reduce the ability to not to get shingles, and I take L-lysine daily because I'm in everybody's mouth. Can you imagine 48 years I'm in everyone's mouth, and because of that, I'm subjected to more disease than most people. I wear a mask, I wear gloves, and by the way, years ago, we never wore gloves. Today, we are wearing gloves, thank God. I did, because of me being cosmetic. I was a model since I'm 2. I wear them for protection, and I saved my life probably, because AIDS came out, and people were not wearing gloves in the dental office. I could write a whole sitcom on what goes on in a dental office. So now I'm at 21 minutes. I have 9 more minutes. Okay, caller number 3. Oh, Sandra, I don't know. I was up all night with pain. I said, where is your pain? It's around here, around here. I said, do you have a back drip? Do you have a sinus condition? Do you have a humidifier running? At this time of year, we have tremendous amount of sinus problems. Oh, I do have a backdrop, and I do have a sinus condition. I said, well, that's number 1. Here's where the sinuses are. And they could put pressure on these roots over here. So if you're pointing to this side and this side, then that's a possibility that you have to prevent. Get to the cause. Don't just look at your teeth. So please put a dehumidifier on and use your water pick and clean the bacteria, because when you have a back drip, it goes all the way in the back, swallow it, gets into the saliva, and I doubt it's the good bacteria. It's thickened mucus. It causes infection, so how good could it be if it causes infection in your sinus? And so you've got to make sure that you have your sinuses clear and free. And you know what else? I am finishing this today with love from the Tooth Fairy and to the Tooth Fairy. Thank you.